Hi guys, and welcome to another episode of Dr. Ming's Anti-Aging Tips. Today we're going to be looking at sunscreen. So if you want to know whether you're using your sunscreen correctly, stay tuned to this channel. So the sun effectively has two very important rays, UVA, UVB. Now the ozone layer does protect us, but with the depletion of the ozone layer, you're getting a lot of rays that is flooding through. Now, UVB and UVA basically have different wavelengths, and your UVB is the one that actually affects the superficial layer of the skin, and that's the one that everyone knows causes skin cancer. So when your sunscreen basically says that it's cancer approved, what it's actually saying is that it's protecting you against UVB. But scientists have now proven that UVA also causes skin cancer, or it's associated with skin cancer. So your squamous cell carcinomas and your basal cell carcinomas and your melanomas, these are all very big fancy names for cells that are changing because of exposure to the sun. Your melanoma is something a bit more complicated, but basically all you need to understand is UVA is also associated with skin cancer. So your sunscreen needs to protect you against UVA and UVB, which most of the sunscreens actually do. Where it gets a bit more complicated is your infrared as well as your high intensity visible light. Now, what is high intensity visible light? That is actually light that's coming from your ceiling, your LED lights, your computer screens, as well as your iPhones, Samsungs. All those devices basically are giving off this high energy visible light that is also very bad for the skin. So as we get more and more knowledge about what is actually damaging the skin, our sunscreens are becoming better and better. So if your sunscreen is just saying UVA and UVB protection, it's not enough. If it says HEV, that's high intensity visible light, as well as IR, which is infrared, it's covering you really on a nice broad spectrum. So the first thing you want to do is look at your bottle. Your bottle should tell you what it's actually protecting you from. Secondly, did you know that sunscreen needs to be applied more than once? Your sunscreen application that's done at 8, after 2 hours, it's null and void. So you need to keep reapplying your sunscreen every 2 hours. My patients, most of the housewives, some of them are also businesswomen, they always tell me that they're indoors, so they don't really need to use sunscreen. That's also false. If you are indoors, the UV radiation of the rays are passing through the window and they're also bouncing off surfaces. So this is reflecting and it's still hitting your face. When you go in hiking, the higher you go, the more exposed you are. Skiing, a lot of my patients, when they go on holiday, they feel that because it's cold, they don't need to protect themselves. The snow actually reflects about 80% of those rays. So on the beach sand, water, the only thing that's kind of helping you is if you're sitting in the shade. Okay, so let's recap. First thing we said is you've got to check the bottle of your sunscreen to check if it's actually protecting you against high energy visible light and your infrared. Second thing, we said that you've got to reapply every 2 hours. Even if you have makeup, it's going to show you a sunscreen that you can use over your makeup. We also said that if you're indoors, in the house, in your office, you still have to use sunscreen. If you're hiking, you are more exposed. If you're skiing, the snow is reflecting rays onto your skin. So you still also need to protect yourself. Another myth was basically if you're dark skin, you still need protection. We do have a sun protection factor built in. It's part of our skin because of our melanin and the protective nature of melanin, but it's not enough. So your sunscreen should be at least an SPF 50, especially if you're in South Africa, because we have really lovely summers and we have also really nice winters as well. So this is the Air Gel 360. It's actually a lovely foam that comes out. It's quite cute, and it just spreads over the skin and it absorbs really nicely. But what I like about Air Gel, it's really quite foamy and light. So this bottle, if I use it every day, lasts me about 2.5 months, which is not bad. This is your gel oil free. You can see that it's kind of messed. Oops. This is tinted, so you get also various tinted sunscreen, so you can use it as your makeup. So this is a lighter one, so for those clients that want to use it as a bit of a base, this is also a really good foundation. The next one is 360 capsules. Now I usually tell my patients who are very, prone to sun damage, or my patients that have pigmentation, they need to be on a topical sunscreen, they need to be on tablets, they need to use sunglasses, a cap, and they've got to use the powder, so the physical sunscreen as well as a chemical sunscreen. So I slap on all sorts of sunscreen on them because I need maximum protection. So this one is my favorite because it gives you 5-hour sun protection. So all my cyclists, my runners who can't really stop and start applying sunscreen, they actually pop a tablet 30 minutes before going into the sun, and this tablet gives your cells extra protection. And this is also from HelioCare 360, and it's got fern block in it. It protects your hair, because I'm all about hair, and your eyes. So these are the HelioCare 360 capsules. They've got vitamin C, which is always a bonus. They've got also vitamin E and vitamin B. Apart from everything else that's protecting your skin, it's also like a skin supplement, which is perfect. So some patients take it every day. I know the patients that are very high risk for skin cancers, I advise them to take it. I have a few patients that have retinal cancers, very rare conditions, so they're also on it because of the potent retinal protection that it gives you. So this is really for the athletes. They have, the prolonged exposure to sun and they really can't stop and reapply every 2 hours. This gives them a little bit more protection. So a lot of my patients want to know, can I substitute this and then not do the topical? Topical's always the best because it's a barrier. It's a barrier over the skin. So I never really tell them take one over the other. Usually, if you want maximum sun protection, just use them, know why you're using them, and then you're able to be more compliant. You can reapply, you know what time to start taking your tablets, you know how much to apply. Now, with regards to the quantity, you need to apply about a grape size amount of sunscreen. I know, the very first time I heard that, I was just like, what are you on about? Apparently, the amount of sunscreen that you apply is very important for the effect. So if you want to pickle your sunscreen, use very little. It's actually pointless. You need to actually use a grape size amount, and that needs to really cover your skin, really give you a good coverage on your neck area. And so with the air gel, you get a nice big clump of foam that usually gives you nice coverage over the face, and then you've got to pump it again to give you the neck and décolletage and hand coverage. So that's important. The amount that you're going to apply as well as the reapplication of your sunscreen is essential. Now, HelioCare has thought about everything, because we have babies and some of the babies cannot use these sunscreens. So Heliocare has brought up a new range which is called Heliocare Pediatric range, and this is basically for the kids that suffer with eczema, psoriasis, kids that are having really inflammatory skin. They can use this. It's safe on them. They actually, it's very hypoallergenic. So for those moms that are looking for really good coverage for newborns, they can actually use Heliocare Pediatrics. I'm a mom of two. I have a 10-year-old and a 7-year-old, and they always complain that when I put the sunscreen on them, they're like, Mom, my eye, I can't see anything. It's burning. So it becomes very dramatic. So Heliocare now has water gel. It's also 360, specifically for kids who are swimming, or in my house I have to have it either way, so that it actually gives you that added protection and they don't have to complain about their eyes burning. Okay, so I'm gonna now discuss the final little gem. Yep, I know I have a lot of favorites. Bear with me. But this is color science. So color science might not look very powerful. It's amazing. So this little powder here, if you can see here, this powder actually has hyaluronic acid. So if your face is dehydrated, it moisturizes it. This is a physical sunscreen. So if you're wondering, people mention physical, chemical. Most of the sunscreen we use is chemical. But if you've ever watched a cricket match and you're wondering, why are those guys wearing that war paint over their nose? They're actually protecting themselves. That's a physical sunscreen. It's almost like a shield that's going over your skin. It's the best sun protection, but we all can't walk around with like faces painted white or pink or green. So this is a physical sunscreen. It's basically like a makeup powder, but it's very potent. So it's got your hyaluronic acid, it's got your DNA repair enzymes in it, it's got an antioxidant layer as well in this, so that it's rebuilding your DNA and getting rid of the reactive oxygen species. So the oxidation, which is basically the reaction or the rays that have now hit the skin that has formed oxidation, or it's causing basically something bad, this sunscreen is going to reverse and try and help that. So it's beautiful. I mean, I have like 4. I have one in the car, I have one in 2 of my handbags, and I have one at work. I know I'm a bit obsessed, but it's amazing. And it's so handy because when the kids are walking around and you just like, stop, I need to apply sunscreen, just quickly put it over them. And as you can see, it's not ashy. It's perfect. And really good because I have oily skin. So if my powder or my face is looking ill, this is what I'm going to apply over because I want the protection as well. So this is really, really lovely. And I'm going to be giving away one of these to one lucky patient or subscriber. So if you really like this post and you enjoyed all the information that I've given you, or you want to take one of these back home with you, I mean, it's valued over 1,000 Rand. It's quite a lot for the sunscreen, but if you're looking at what this actually does for your skin, it's priceless. So if you really want to get one of these, then hit the subscribe button. Follow me on my Instagram, which is drminks_medical spa. Tag 4 of your friends, only 4 people that are new, that don't know me. Tag them, get them involved, promote sunscreen awareness. That's what it's all about. The reason for this channel was to create awareness directly to you. So it is your cosmetic handbook, meaning all the relevant information that you need to know that sometimes we don't get enough time to tell you during the consultation. This is the channel that you want to go to. Leave your questions, leave your comments. I'm happy to answer them. Remember, when you subscribe, there's a little bell button there. So just hit that bell button, and that basically will tell you whenever I post something new, you will be the first to know about it so that you don't miss out. Remember, Dr. Ming's anti-aging tips. If you've enjoyed it, thumbs up. Until next time.